In the absence of any clarification questions, we'll move on to our last speaker, Joanne Spahn, and welcome her to the podium.
Morning. I represent the USDA HHS Dietary Guidance Development Project, looking at children and birth to 24 months, children from birth to 24 months and pregnant women. This presentation has three aims. First, to identify the purpose of the Birth to 24-Month Pregnant Women Project, which is to inform the development of food-based guidelines for these life stages. Second, to familiarize you with the 4 phases of the project, which will span 8 years from 2012 to 2020. And finally, to provide a little insight on how the work of this project may complement the work that you're currently doing. So the purpose of the Birth to 24 Pregnant Women Project is to inform the development of food-based guidelines for the birth to 24-month and pregnant women life stages. And the goal is to initiate the review of evidence for these populations and to initiate the development of a evidence base to support the integration of these life stages into guidance that is a component of the dietary guidelines for Americans. As you all know, the dietary guidelines is the cornerstone for federal policy for food and nutrition guidance supporting health, and the birth to 24-month age group has not been a topic that's been a focus of that report, primarily because of the differences that Dr. Britton described in terms of the dietary patterns and the differences in the science that is required to be reviewed to support this age group in the guidelines. But there's been a recent call for inclusion of these life stages in the overall guidance. And so this project is designed to initiate that review to make this happen. So the multi-phase timeline to support the project spans from 2012 to 2020, which included a timeout period to support the development of the 2015 dietary guidelines. It's a collaborative effort at this point involving over 90 leading scientists and program leaders, really focused at providing a broad evidence foundation to integrate these populations into the guideline process. The plan is to use a highly transparent process that is similar to that used for the development of the guidelines. They uses multiple sources of evidence from the NEL Systematic Review Library, from high-quality existing reports such as the DRIs and other IOM reports, and data analysis to inform the development of guidelines. The multi-phase timeline began in 2012, and it was initiated by the Office of Disease Prevention and Health Promotion over at HHS, along with the Center for Nutrition Policy and Promotion within USDA. And for phase 1, these offices partnered with the Eunice Kennedy Shriver National Institute of Child Health and Human Development to devise a 3-tier committee structure that hosted 2 workshops and supported the work of 3 working groups that identified 40 important topic areas that could form the foundation for our future reviews to support guidance. These experts were asked to evaluate the feasibility of developing guidelines in this area. Was the science strong enough? And they were asked to identify gaps in the literature that currently exist so that they could be components of future research agendas. And finally, they were asked to identify systematic review topics that would be valuable to review in the interim. And all of the materials that were developed by the Phase 1 work groups are available on the NEL website at nel.gov. And the process is outlined in 2 publications that were published in AJCN in March 2014 by Rayton et al. And Obagi et al. I'd like to note that during Phase 1, the focus was on the birth to 24-month population, and so there was limited coverage of pregnant women, primarily related to nutrition of pregnant women as it would impact infant health outcomes. We're currently in Phase 2 of the project, and the Agriculture Act of 2014, known as the Farm Bill, calls for the integration of the birth to 24-month population and pregnant women in future dietary guidelines starting with 2020. And so this expanded the scope of the initial project. So now we have the PW, pregnant women, in addition to the focus on the birth to 24-month population. So as part of Phase 2, the government has identified a federal expert group known as a FEG, and we are working to identify expert panel members to serve on technical expert collaboratives to support the review of the evidence. One of the first things that needs to be done is to consider how are we going to integrate the pregnant women into these reviews. And so right now we have 3 plans. Number 1 is to ask the technical expert collaboratives to take a look at the questions that have been identified and prioritized in Phase 1 and prioritized by the FEG to see whether or not these questions could be expanded to include the maternal exposure and the maternal outcomes. The second process that is being considered is doing a similar process to Phase 1 for the identification of important questions related to pregnant women. And then the third point would be to provide the 2020 Dietary Guideline Advisory Committee this list of important systematic review questions to consider as they review the literature for the development of their advisory report. The FEG will also identify data needs that may exist that could be addressed in this interim time, and public comments will be requested. In Phase 3, the FEG will be working to fill some of those data gaps that have been identified, and they'll also develop a technical report that will use data or information from the NEL systematic reviews, from data analysis that has been done, existing authoritative high-quality reports, and public and federal agency comments. And then during Phase 4, the 2020 Dietary Guideline Advisory Committee will be provided this FEG technical report to consider as a source of evidence. They'll do their own review of current evidence, hopefully addressing some of those questions that were related to pregnant women, and they'll develop their recommendations within the Dietary Guidelines Advisory Committee report. And then the federal government will use those recommendations to, in turn, develop the 2020 Dietary Guidelines for Americans, which would then integrate guidelines for the birth to 24-month age group and women who are pregnant. So I'm going to transition now to describe the work of Phase 2 of the process, and in particular, the work of the FEG and the technical expert collaboratives working with the NEL team in the review of the evidence. So the Birth to 24-Month Pregnant Women Project will address research questions in 4 broad topic areas with the support of 3 technical expert collaboratives. One tech will be looking at human milk and infant formula feeding. Another will be focusing on taste and preference development and feeding practices and methods. And another expert panel will be working with the FEG and the NEL staff to look at complementary feeding, and in particular, foods and beverages. So the NEL reviews will examine the impact of infant feeding practices and the duration of exclusive breastfeeding on a variety of outcomes, including nutritional status, physical growth and development, cognitive, behavioral, or neuromotor development, body composition, overweight and obesity, and allergy and asthma. The reviews focused on feeding practices will be looking at short-term, medium-term, and long-term health outcomes in exclusively breastfed, exclusively formula-fed, and mixed-fed infants to see whether or not there are differences in nutritional status and health outcomes that might impact recommendations for complementary feeding. Current U.S. and global recommendations related to exclusive breastfeeding primarily rely on the 2002-2012 WHO systematic reviews. There's been recent evidence that has caused some interest in reviewing the evidence for the potential for perhaps calling for earlier introduction of complementary feeding due to some of the evidence related to allergies and nutritional status. And so that's one of the areas that the work groups will be focusing on during their systematic reviews. They'll probably take into account also some of the modes of feeding, particularly feeding breast milk, whether it's directly from the breast or if it's freshly expressed breast milk or stored breast milk or banked breast milk. All of those factors will be considered during that review. The NEL will review or examine the impact of exposure to nutrient-dense, salted and sweetened food and feeding style and setting on a variety of outcomes, including dietary intake, physical growth and development, taste and preference development, body composition, including overweight and obesity, and oral health. The review will explore early exposure to foods and flavors that may affect the development of preferences or likes and dislikes. The review will explore the short-term and long-term relationships between this exposure and preferences, and will look not only at the nutrient-dense foods, which might include dairy, fruits, vegetables, meats, but it'll also look at salted and sweetened foods and some of the biological, cultural, and individual factors that might influence preferences of foods of this type. Finally, a large number of children in the United States consume meals or snacks outside the home, and so the reviews will look at the relationship between eating outside the home, taking into consideration the setting and the caregiver, and dietary intakes in terms of quantity and quality. The NEL reviews will examine the impact of when complementary feeding starts and what and how much is fed on a variety of outcomes, including dietary quality, physical growth and development, allergies, asthma, infection, or inflammation, body composition, including overweight and obesity, and disease risk. Specifically, The NEL reviews will examine complementary food choices for human milk-fed, formula-fed, and mixed-fed infants, and look at the macro and micronutrient distributions that are associated with positive health outcomes. We've also been asked to look at specific foods, and in particular, the intake of beverages, which might include fruit juices and sugar-sweetened beverages. There's been a lot of interest in really looking at the intake of cow's milk and the amounts and the fat distributions recommended for the 6 to 12, 12 to 24-month age groups, and also the use of cow's milk, other cow's milk products like cheese, yogurt, etc. So in the next few slides, I just want to talk about how the work of the B24 Pregnant Women Project may complement the work that you are currently involved in. Clearly, the nature of the questions vary because the goals of the projects are different, but things are similar, and the reviews of evidence may be similar in some of the areas that I've identified in the black section on each of these 3 slides that will cover the goals, the topics, and some of the content of the individual questions. The goal of both projects is to provide guidance for federal programs, whether it be the dietary guidelines or the largest federal program that targets this life stage. But the review of nutrition and health scientific evidence related to the birth to 24-month and pregnancy life stages will be valuable across the board and will inform important policy and program actions. In terms of the topic areas, the Birth to 24 and Pregnant Women Project has a lot of questions that are related to complementary feeding and specific food options that are relevant to the WIC food packages. And in particular, there's a series of questions from the Birth to 24-month and the Pregnant Women Project that address human milk and breastfeeding and infant formula feeding, and how specific food practices or choices might influence the need for complementary foods, and perhaps the type and when they would be introduced. And finally, there's some complementary questions related to just topics. Topics or reviews of evidence that will look at exclusive breastfeeding, and a particular interest in new literature that's currently available in the area of allergy. There's quite a number of complementary food questions looking at optimal distributions of macro and micronutrients, types of foods to encourage during early feeding, when to encourage the initiation of complementary feeding, and then particularly some look at particular foods like cow's milk products, and juice. So in conclusion, the Birth to 24 Pregnant Women and the WIC food package reviews are complementary, and they are occurring concurrently. The Birth to 24-month Pregnant Women systematic reviews may complement work conducted by the committee in the area of human milk and infant formula feeding and complementary foods and feeding. And the Birth to 24-month reviews that might support implementation of dietary guidance include those that focus on taste and preference development and feeding practice and style. For further information related to the Birth to 24-month and Pregnant Women Project, There's information, and particularly we'll be requesting public comments on the CNPP USDA.gov website, which is currently under construction, but will be open very soon. Materials from the Phase 1 component of the project are currently available on nel.gov, and that materials related to the systematic review will be updated at periodic times. And I've added my contact information and also Jean Altman, who is our project manager, if you have any additional questions. So thank you very much.
Thank you, Joanne. And as we open this up for clarification questions from the committee and consultant to Joanne, I'd like to invite the other three speakers to go ahead and come up and take a seat for the panel discussion.
Hi, is this on? Hi, Joanne. I notice a lack of attention to the lactating woman. The legislation added the pregnant woman. Are you planning activities as part of this that really look at the lactating woman as much as you're looking at the pregnant woman?
That's a good point. I know that the initial work was really focused on the birth to 24 month. We've talked about pregnant women, but haven't really identified the lactating women as a particular focus. So that might be something I can take back to our project team to see how we might integrate that important population.
It's embedded in the last working group.
Joanne, I actually had the same question as Kathy, and I think in something as visible as the dietary guidelines that would come out in 2020, to not have a specific addressing of the breastfeeding woman really undermines, I think, the importance of breastfeeding. And I've been involved with this project with you, and I know they're going to consider the effect of diet on human milk as far as the baby's concerned, but not to speak to the lactating woman, I think, is really an oversight.
The questions for Phase 2 of the review are not finalized yet. So as the technical expert collaboratives join the team to look at those questions, that will be probably one of the first tasks of that group, is to take a look at the current questions and expand them to maybe include, I would say, the pregnant women, and I think you make a good point in terms of the lactating woman. And it's just such a family of outcomes and a family of